Aloha, everyone. I'm Dr. Tom Johnson from Kalani Total Health Center. Today, we're talking about discogenic low back pain and discogenic neck pain. Now, many of you are not aware that low back pain and neck pain are the world's leading cause of pain and disability. Now, of the many causes of low back pain and neck pain, discogenic pain is one of the most severe. Ask anyone that's had a flare-up of a disc-related back or neck pain, and they will tell you that was the most severe pain they've ever had. It affected everything in their daily life, from sleeping, sitting, standing, walking, bending, twisting, putting their clothes on, cooking, cleaning, going to work, everything. Everything's affected with disc-related back or neck pain. Now, prevalence throughout the world today, it affects male and female equally. All ages, typically from your 20s, 30s, 40s, 50s into your 60s are typical, although it can affect any age group depending on the mechanism of injury. Now, etiology, what's the causation of it? There's many causes, but the typical ones are lifting too heavy objects, poor mechanics of lifting or movement disorders, sitting too long, standing too long, again, car accidents, personal injuries, work injuries. The list goes on and on and on. Now, disc injuries can be acute and chronic. The acute disc injuries are a brand new injury. The hallmark is severe pain, inflammation, swelling. Chronic injuries are just that, flare-ups of acute injuries or chronic degeneration of the disc as well. Again, that can lead to many years and years of chronic neck and back pain as well. That's caused by the disc. Now, when we get into the specific types of disc injuries, the disc can be torn on what's called the outer annular fibers of the disc. That typically is a severe, intense, sharp stabbing type of pain. Again, hallmark is inflammation, swelling, pain. Or we can have a disc herniation. When we have a tear in the annular fibers, it allows the inside of the disc called the nucleus pulposus to migrate, herniate out of the disc and produce a disc bulge or disc herniation. Now, of those disc bulges and herniation, there's two types. There's ones that are contained, meaning the fibers and the herniation material is still contained in the disc, or it can be not contained, meaning it fragments out. Both are severe, but the fragmentation is the most severe. Now, that can later produce symptoms in terms of nerve root compression. It can produce compression on the spinal cord as well. Symptoms now are radiating, tingling, numbness, paresthesias down the arm or the leg. That can lead to weakness, changes in gait or walking, grip strength. That can lead to changes in bowel bladder function, red flags, saddle anesthesia, 𝐷𝐴𝐴 syndrome. The list goes on and on and on. Now, the key part that I want people to know is why it's so important to deal with that disc injury right away. The reasons why typically I see most patients that go to their family doctor and the back or neck pain is typically misdiagnosed as a simple neck strain or sprain or low back sprain or strain. Treatments typically are pain medication, anti-inflammatory, muscle relaxers. Typically they're told to go home and rest until the pain goes away. However, that set the stage for chronic flare-ups, because it wasn't diagnosed correctly and it wasn't treated correctly as well. The earlier you detect disc-related spinal injury, the easier it is to fix, the less costly and less severe the symptoms will be, and the less risk for progression or chronicity. At Kalani Total Center, we specialize in the diagnosis and treatment and rehabilitation of disc-related discogenic neck and back pain. But this process begins with coming to the clinic and sitting down with one of our doctors who specialize in disc-related spinal disorders, and starts with a very detailed health history, your overall health history, your injury history, personal injury or work injuries as well, sports or activities that you commonly enjoy doing or previous injuries to those. Then it transforms into a comprehensive physical examination where we look specifically at the disc using very specific orthopedic testing, neurological testing, palpatory testing, range of motion, body movement, muscle strength testing. Again, the list goes on. That then can lead to the ability for us to prepare a specific treatment plan based on those exam findings for that back or neck disc-related pain. But it all starts with that health history and comprehensive physical exam. With those two entities, now we can actually prescribe and develop a specific treatment plan for your disc-related back or neck pain. Now, at Kalani Total Center, we have an integrated team of healthcare providers, meaning that we have a medical team, chiropractic team, physical therapy, massage, acupuncture, clinical nutrition. We have many tools in our toolbox to help you with your back or neck pain, especially that discogenic neck or back pain. Not all clinics are the same. I recommend you do your homework. Find a clinic such as ours that specializes in spinal disorders and discogenic neck or back pain. At Kalani Total Center, We're excited to have you and your family here in the clinic. Please contact our office as soon as possible. Let's get you checked. Let's get you in the clinic. Let's detect these disc-related back or neck pains. Let's get them fixed as well. I'm Dr. Tom at Kalani Total Center, your one-stop holistic healthcare shop. Aloha and mahalo.